Ready? Let's see how many nursing questions you can answer correctly. This is MJMRN compilation review. Let's start. Question. The nurse is evaluating 4 patients. Which patient requires immediate escalation? A. Patient with respiratory rate of 18 breaths per minute, speaking comfortably, warm extremities. B. Patient with respiratory rate of 24 breaths per minute after ambulation that returns to baseline within minutes. C. Patient with respiratory rate of 30 breaths per minute, increasing work of breathing, delayed capillary refill, and normal blood pressure. D. Patient with heart rate of 88 beats per minute and oxygen saturation of 97% on room air. Correct answer. C. Increasing work of breathing combined with delayed capillary refill indicates concurrent respiratory and perfusion compromise despite preserved blood pressure. This pattern suggests failing compensation and requires immediate escalation. Question. Which patient demonstrates the highest risk for rapid clinical deterioration? A. Heart rate 82, respiratory rate 16, warm skin, speaking normally. B. Heart rate 118, respiratory rate 30, cool clammy skin, delayed capillary refill, normal BP. C. Heart rate 90, respiratory rate 18, BP 138/84, no respiratory distress. D. Heart rate 84, respiratory rate 20, oxygen saturation 99%, eating lunch. Correct answer. B. The combination of tachycardia, tachypnea, poor perfusion, and preserved blood pressure is characteristic of compensated shock and requires urgent intervention. Question. Which documentation entry best reflects high-quality nursing assessment? A. Patient appears uncomfortable. B. Respirations seem faster today. C. Respiratory rate increased from 18 to 28 breaths per minute over 4 hours. Patient using accessory muscles, speaking in short phrases, capillary refill 4 seconds. D. Vital signs acceptable. Correct answer. C. Objective, measurable, and trend-based documentation clearly communicates deterioration and supports clinical decision-making. Question. A nurse notices that a patient who had been using accessory muscles to breathe is now breathing more quietly but appears increasingly drowsy. Which interpretation is most appropriate? A. The patient's respiratory status has improved. B. The patient is relaxing after treatment. C. Respiratory muscle fatigue may be causing impending respiratory failure. D. Oxygen therapy has resolved the distress. Correct answer. C. Decreasing respiratory effort accompanied by declining level of consciousness after prolonged distress suggests respiratory fatigue rather than recovery. Question. A patient recovering from abdominal surgery reports feeling more tired than earlier. Assessment reveals respiratory rate increasing from 18 to 25 breaths per minute, mild diaphoresis, and cool hands. Which nursing action is most appropriate? A. Administer prescribed pain medication and reassess later. B. Encourage sleep to reduce fatigue. C. Perform a focused assessment and promptly communicate the findings. D. Wait until blood pressure changes occur. Correct answer. C. Increasing respiratory rate combined with diaphoresis and cool extremities suggests early deterioration requiring immediate assessment and communication. The Respiratory and Perfusion Clues Volume 3 2nd edition book of the Clinical Red Flag Files series is now on Amazon.